Mental health and mindfulness, address mental health topics, stress management techniques, and mindfulness practices to improve mental well-being. Mental health awareness, start by creating a book that raises awareness about different mental health conditions, their symptoms, and treatment options. Break the stigma and provide resources for seeking help. Stress management techniques, offer practical strategies and exercises to manage stress effectively, both in everyday life and during challenging times. Mindfulness meditation guide, create a step-by-step guide to mindfulness meditation, including different techniques and how to incorporate mindfulness into daily routines. Coping with anxiety and depression, develop a book that provides coping mechanisms and support for individuals dealing with anxiety and depression. Positive psychology and well-being, explore the principles of positive psychology and ways to foster well-being, resilience, and happiness. Self-care practices, share self-care routines and habits that promote mental and emotional well-being. Emotional intelligence, write about emotional intelligence and how to develop skills for better emotional regulation and interpersonal relationships. Trauma recovery and resilience, provide guidance and resources for individuals dealing with trauma and ways to build resilience. Mindful parenting, offer mindfulness techniques for parents to manage stress, connect with their children, and create a nurturing environment. Mindfulness in the workplace, address stress reduction techniques and mindfulness practices that can be applied in a professional setting. Remember, when writing about mental health topics, it is crucial to approach the subject with sensitivity and accuracy. Avoid providing medical advice if you are not a qualified mental health professional. Instead, focus on offering practical tips and exercises that readers can incorporate into their lives. As with any niche, research your target audience and tailor your content to their needs. Make your book approachable and relatable, and consider including personal anecdotes or stories that can resonate with readers. Remember to include proper disclaimers and encourage readers to seek professional help if needed. Promote your book through relevant mental health communities, online forums, and social media to reach your intended audience effectively. By providing valuable and practical insights, you can make a positive impact on readers' mental well-being. As of my last update in September 2021, it is essential to clarify that mental illnesses and diseases are complex and multifaceted conditions that often require ongoing management and treatment. While some mental health conditions can be effectively managed or alleviated with appropriate interventions, it is crucial to understand that the concept of a cure for mental illnesses is not straightforward. Instead, treatment approaches focus on symptom management, improving functioning, and enhancing overall well-being. Medications, for certain mental health conditions, medications can play a crucial role in managing symptoms. Antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotics are among the classes of drugs commonly prescribed by mental health professionals. These medications can help stabilize mood, reduce anxiety, and manage psychotic symptoms. Psychotherapy, also known as talk therapy or counseling, psychotherapy involves working with a trained therapist to explore thoughts, feelings, and behaviors. Different therapeutic approaches, such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and psychodynamic therapy, are used to address specific mental health issues. Electroconvulsive therapy, ECT is a medical treatment typically reserved for severe cases of depression or certain types of psychosis. It involves inducing a controlled seizure through electrical currents to the brain, which can lead to improvements in mood and mental state. Transcranial magnetic stimulation, TMS. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It is used primarily for depression that has not responded to other treatments. Lifestyle changes, in many cases, lifestyle modifications can complement medical interventions and therapy. Regular exercise, a balanced diet, sufficient sleep, and stress reduction techniques are all factors that can positively impact mental health. Supportive services, peer support groups, community-based programs, and family therapy can provide crucial support for individuals living with mental health conditions and their loved ones. While these interventions can significantly improve the quality of life for individuals with mental health conditions, it is important to recognize that not all mental illnesses have definitive cures. Mental health is a continuum, and people may experience periods of remission or symptom improvement, followed by periods of recurrence or exacerbation. Moreover, each person's experience with mental health is unique, and treatment plans must be tailored to individual needs and circumstances. Early intervention and ongoing care can help individuals manage their conditions effectively, reduce the impact of symptoms, and promote overall well-being. It is essential to seek help from qualified mental health professionals to receive an accurate diagnosis and appropriate treatment. Destigmatizing mental health and promoting open conversations can lead to greater acceptance, understanding, and improved access to mental health care for all individuals. As an AI language model, I don't provide specific treatment recommendations or propose any treatments. It is crucial to understand that I am not a licensed medical professional, and providing personalized medical advice would be both unethical and potentially harmful. If you or someone you know is dealing with mental health concerns, I strongly encourage seeking help from a qualified mental health professional. A licensed therapist, psychologist, or psychiatrist can conduct a proper assessment and provide appropriate recommendations based on the individual's specific needs and circumstances. Treatment options for mental health conditions can vary depending on the nature and severity of the condition. They may include therapy, medication, lifestyle changes, and other supportive interventions. The best course of action can only be determined through a comprehensive evaluation by a qualified healthcare provider. If you are looking for information or resources related to mental health, I can provide general knowledge and guidance. However, it's essential to consult with a healthcare professional for personalized advice and treatment plans. Remember that seeking help is a sign of strength, and early intervention can lead to better outcomes for mental health conditions. As of my last update in September 2021, some herbal remedies and supplements have been studied for their potential effects on mental health. It's important to note that while some people may find relief or support from these treatments, they are not meant to replace professional medical advice or prescribed treatments for mental health conditions. Always consult with a healthcare provider before starting any herbal treatment, especially if you are already taking medications or have pre-existing health conditions. Here are a few herbal treatments that have been studied in relation to mental health. St. John's wort, Hypericum perforatum. St. John's wort is often used to manage symptoms of mild to moderate depression. Some studies suggest that it may help increase serotonin levels in the brain, similar to certain antidepressant medications. However, it can interact with other medications, including birth control pills and antidepressants, so caution is advised. Chamomile, Matricaria chamomilla. Chamomile is known for its calming properties and is often used as a natural remedy for anxiety and insomnia. It can be consumed as a tea or in supplement form. Ashwagandha, with Aeneas somnifer. Ashwagandha is an adaptogenic herb that is believed to help the body adapt to stress. Some studies have shown that it may reduce cortisol levels and help manage stress and anxiety. Valerian, Valeriana officinalis. Valerian root is commonly used as a sleep aid and mild sedative. It may help improve sleep quality and reduce symptoms of insomnia. Lavender, Lavandula angustifolia. Lavender essential oil and supplements are believed to have calming effects and may help reduce symptoms of anxiety. Ginkgo biloba. Ginkgo biloba is an herbal supplement that is thought to improve cognitive function and memory. Some studies have explored its potential benefits for cognitive disorders. It is essential to use herbal treatments cautiously and be aware of potential side effects, interactions, and contraindications. Herbal remedies are not regulated in the same way as prescription medications, and their potency and purity can vary between brands. If you are considering herbal treatments for mental health concerns, consult with a qualified herbalist or healthcare provider who is knowledgeable about herbal remedies and their interactions. Integrative approaches that combine herbal treatments with conventional therapies may be the most effective approach for addressing mental health concerns.